Richard Nixon in a New York hospital has meant conflicting emotions. A national day of mourning next Wednesday, sitting somehow uneasily with the abiding memories of the shame of Watergate.
And liftoff of the Space Shuttle Discovery with the Hubble Space Telescope, our window on the universe.
Good afternoon.
Welcome back to BBC World News. Let's turn to our latest headlines. India records its highest daily death toll as its COVID crisis spirals. Large parts of the country are now in lockdown as people fight for hospital beds, oxygen and medicines. And lawyers for the breakaway European Super League file injunctions to stop clubs and players being banned by UEFA and FIFA as the football row ratchets up. Now let's turn to breaking news from the last few minutes. And the European Union medicines regulator has said that Johnson&Johnson's coronavirus vaccine should be issued with a warning about rare blood clots. The agency's safety panel reviewed 8 reports from the United States of serious cases of unusual blood clots, one of which was fatal. It said the overall benefits of the jab outweighed the risks of those side effects. Let's talk now to Ralph Reinches, who's Professor of Epidemiology and Public Health Surveillance at Hamburg University in Germany. And welcome to the programme. Your assessment of what you just heard from European regulators.
Good afternoon. Yeah, the decision by the European regulators is not surprising. It's quite logical, and everybody working in this field would have expected an advice like this.
Why have we seen this issue in some countries but not in others?
We have seen this. Depends on different factors. First of all, this side effect is very, very rare, and it seems to be linked more in younger adults than in older ones, and more in females than in males. And countries who first vaccinated millions of people, young people, mainly females, with vector-based vaccine, saw this more than other countries.
You used a phrase in that answer, vector-based vaccines. We've seen these side effects in those vector-based vaccines. Remind us what those are.
Yeah, these are vaccines which use a vector, a virus, to introduce the vaccine into the people to be vaccinated. It's vaccines like AstraZeneca and now also Johnson&Johnson.
To be more certain, what is actually needed? Do we need to do more research, or as the drug gets used more, will we get more information?
Exactly. The more often a drug is used, the more likely it is that even very rare side effects can be found. You just reported that in the US they had about 8 cases in more than 7 million people vaccinated. So it's very rare, almost 1 in a million only. And therefore you have to vaccinate lots of people to see a considerable number of these very rare side effects.
Why those regulators have said the benefits certainly outweigh the risks. Ralph Reinzig, thanks very much for joining us here on the program. Thank you. Now, America is bracing for the outcome of a case that is seen